Hello, this is Janette Angulo, the Imperial County Public Health Director. Today, I'll be providing you three different updates. The first one has to do with the data monitoring list. The state of California has a data monitoring list, and those counties on such list are there because certain parameters have not been met, and those parameters are set by the state. Now, for Imperial County, Imperial County has been on that list for several weeks, and there's different areas that we must monitor. The first area has to do with um, COVID-19 stability in the community, and we monitor a couple of different data sets. Now, we keep track of the rate of cases per 100,000 population. The goal is to be less than 100 per 100,000 population. Imperial County has made some great progress. We are currently at 209.8 per 100,000 population. In prior weeks, we had reached up to 800. So great job there. The testing positivity percentage, we must have a 7-day average of less than 8%, and currently we are at a 13.8% there too. We made some great progress in prior weeks. We had reached high 20s, low 30s. And then there's some other data sets such as, number of hospitalizations, number of ICU beds available, and some other metrics. The second area we look at is the capacity of hospitals to serve this population. Now, one of the areas the state looks at is the percent of intensive care unit beds available, and the goal is to have over 25% of beds available, and currently we are at 17.6%. The state also requires that hospitals have enough ventilators as well as personal protective equipment and a surge capacity plan in place. The third area that's looked at is guidelines for essential workers and making sure that those are in place. In Imperial County, we use the guidelines that are set forth by the state of California and the federal government. Next, we must have capacity to test in our community. The requirement is 1.5 tests per 1,000 population, and what we've seen is that we've reached 4 tests per 1,000 population. Additionally, we must have 15 contact tracers at the public health department per 100,000 population. The state has provided support in this area, and currently we are at over 50 contact tracers per 100,000 population. And then the last two areas have to do with our vulnerable populations. So we must have the ability to house homeless individuals and those that are higher at risk for COVID-19 or who test positive for COVID-19. And additionally, we work with our skilled nursing facilities. They must have mitigation plans in place, as well as a 14-day supply of personal protective equipment. Once we meet the aforementioned requirements and show stability for 14 days, and after talking to the state and submitting a written report, then we may move to the next stage or to reopening businesses. Until then, we keep working on our metrics. We keep making progress. So we're not quite there yet, but we are going the right direction. We have a new COVID-19 toolkit that the community can access at the Imperial County Public Health Department's webpage. There you'll find different kinds of resources that you can share with your family, your friends, and the community in general. So we invite you to access that toolkit and again to share those COVID-19 prevention messages with our community. COVID-19 testing is still available in our community. This is through the OptumServe sites that you'll find in Calexico, Brawley, and in Imperial. The test is at no cost. It's available Monday through Friday, 7 a.m. to 7 p.m. And you must make an appointment via internet or by calling. We encourage those that are in need of a test to please access this resource. Thank you.